Now we are. We will be recording the session this morning so that it can be posted on Whova, and it will be available for anyone to view at any time up to 3 months after the conference ends today. So I invite you to please rename yourself and add any of your pronouns as you would like to be referred throughout the workshop. And if you have any questions, to please add them to the chat. We hope that you have hold on to any questions you may have until the presentation is done, and we welcome any interaction after that. So without further ado, I would like to introduce Cristina Camacho, and she is the Community Network Coordinator for the Kern Community Foundation. And this is the group who has been completely integral in the success of our ACEs work in Kern County through the Kern Connected Community Network. And she'll be sharing a little bit more information on that today, as well as Stephanie Martinez. She is the Senior Community Engagement Manager with Unite Us, and you'll be hearing a little bit more information about the actual system itself and how that works to provide a smoothless referral process to families in the community from one point to the next. So ladies.
Okay. Thank you, Paula. So as Paula mentioned, my name is Cristina Camacho. I am the Community Network Coordinator for Kern Community Foundation. We are the community convener for the Kern Connected Community Network, and we work side by side with Unite Us to make this network work for our county and for the people who live here. So let me switch my slide. So the Kern Connected Community Network was launched to help provide a smooth transition for patients to community resources. KCCN creates efficient linkages between hospitals, clinics, and local community organizations throughout Kern County that provide services vital to underserved populations. So one of the great things about KCCN is that we're able to send electronic referrals not only within hospitals and clinics, but also within organizations who are assisting with housing, transportation, food assistance. And we've been able to collect a lot of data that has been happening here in Kern County. And Unite Us is a technology platform that we use. So they help streamline these electronic referrals. They collect the data. They also have a great team that helps make sure that the referrals, there's activity in those referrals. They don't sit too much in people's inboxes. They also work with organizations to help build them out in the network. And they also assist with workflow planning. So if you want to know, how your organization is best built out in the system, what kind of data you're creating for each program, they do a great job and provide training to your staff members and your leadership team. So we're very happy to partner with Unite Us in this initiative. I would like to share with you a video. So it's about a 3-minute video, but it illustrates really well how these networks work. Kern County is one of the networks in Unite California that is very active on the network, and Unite Us is also nationwide. So I'd like to show you this video that best illustrates how it all works.
We all know how important it is to address
My apologies, let me start that again.
We all know how important it is to address people's health and social needs early to improve outcomes. However, today's fragmented landscape of care doesn't always make it easy for people to get help. What if everyone could get the care they need when they need it? And we had the ability to track it all to actually improve the way care is being delivered. No paper referrals, no pamphlets, no missed appointments. That's where Unite Us comes in. At Unite Us, we're transforming the system to ensure that health and social care providers can work together in one network. With our suite of solutions, we've been working hand in hand with local partners to build healthier communities across the country since 2013. How does it work? Anna's story is a great example. This morning, Anna arrived at her local food pantry. She told the staff there that she was struggling to pay her utility bill for that month. After capturing Anna's consent to have her information shared across the Unite Us platform, they immediately referred her to an organization offering income support through Unite Us, and Anna was able to get help that week. Since Anna had already been referred to the food pantry through Unite Us, we located her record, and this referral popped up on her timeline for both organizations to see. Once Anna received money to cover her utilities for the month with the help of her financial assistance provider, the coordinator there securely sent a status update back to the food provider. By working together, they made sure she got the care she needed. Every community is different, which is why Unite Us supports flexible network structures. Our system is always evolving. No matter where we start, our goal is to make sure everyone has access to the network. Unite Us securely tracks every health and social care referral, interaction, and outcome across Anna's care journey, and not just whether a need was addressed or not, but what actually happened. This data allows us to assess what worked and how to improve the quality of care for Anna and people just like her. The impact of our technology depends on the people using it. That's why we have an engagement team that's dedicated to growing and improving the network and its performance over time. With the data generated by our platform, we can identify what's happening and where there may be gaps in resources. By empowering our partners with these insights, we can better address people's needs and even predict who will need services, when, and where. In time, the community-based organizations can be paid the same way the healthcare system is for the work they do. Anna's story is one of many just like hers. Here at Unite Us, we envision a world of truly connected communities. Join us in getting there, one story at a time.
So as the video mentioned, one of the great things about Unite Us is that we're able to track whether or not a patient or a client receives services. You get some feedback, from the organizations to see if their referral was accepted, rejected, or if the client was placed under review. And knowing that, you're able to better assist that client.
Christina, you're on mute.
Oh, there you go. Thank you. Let's see. There we go. Are you guys able to hear me now? Okay, great. Through the Kern Connected Community Network, we are building a community solution to address the social determinants of health and link individuals to community resources. So we are hoping to, as if a client comes into a clinic and they have high blood pressure, and they're speaking with their healthcare provider, and they're letting them know, hey, I'm stressed out. I'm worried about, I can't make rent this month. I need assistance with utility bills. Those are some of the things that healthcare provider can connect them to resources out in the community, and not only serve the patient's immediate need of help, but also provide them with an all-around service of, if your blood pressure is high, it's probably because you're stressed out from these main things, right? And so, being able to just take care of the client in a closed loop system is just a great way to improve health in the community. Let's see. Building our vision. So Kern community residents are easily connected to the right service quickly and efficiently. With the Unite Us platform, as folks, you're having conversations, you can identify that a client or a patient needs food assistance and utility assistance. So when you pull up the client's record, you will just refer them out to that, select that service type, and then you'll be able to select the organization that is closest to the client's address that they can receive those kinds of services. You are also able to take a look at that organization and take a look at their eligibility requirements to see if your patient or client is able to receive services through this organization. Service providers can view, coordinate, and collaborate with one another. I think that is, sometimes folks get stuck in the system, right? And they're unable to navigate the system themselves. And they are in need of, case managers or people in different organizations who are able to navigate these services because they are the experts, right? So if a client gets referred out, a case manager can easily follow up with that referral to see where it sits in the Unitas platform and see whether the client is placed under review for eligibility or if they're on their way to receive these services. And so they can better communicate with the client to see if there's any more information that is needed, and then communicate with other case managers to make sure that the client is being taken care of. Outcomes data is tracked. So one of the great things about Unitas is that every referral, every recall, every information that is in the network is tracked. And so we're able to see, how many clients needed food assistance, how many clients were in need of housing and shelter. This data could be used to show the gaps in services here in Kern County, and it could also be used as a way to show, that the need is needed here in Kern County through grant proposals, or if you are requesting funding, you're able to use this data. And one of the things too that you're able to do with Unitas is as soon as you send or receive 5 referrals, you're able to access something called Tableau, which shows you the data, which allows you to analyze the data in an easier way and pull reports from there as well. Currently, we have about 98 plus partners. We actually did hit that 100 mark already, but those organizations are still being built out in the system. So we stick with the 98 plus. All of these organizations are active on the network, and you could also go to, and I'm going to share it on the chat. You can go to kernfoundation.org/KCCN, and there you will be able to find the full active partner list in our webpage. So, just go onto that link that I just sent in the chat box, scroll all the way down, and you'll be able to download the active partner list so you can see what partners are currently active on the network. Okay. I'd like to share with you a bit of data from Kern County. So this is real, these are real numbers since the launch of KCCN in December of 2019 until March 18th of 2022. So since our launch, we've been able to serve 1,520 clients in Kern County. We've been able to send 774 electronic referrals and build out 1,761 cases. Of the clients, the 1,520 clients that were served here in Kern County, the top needs that we were able to identify were individual and family support, as you can see here, food assistance, housing and shelter, employment, physical health, utilities, benefits navigation, clothing, and household goods, income support, and transportation. As you can see here, you can also select the organization or program that you would like to pull the same data for. And here at Kern Community Foundation, our #1 need is not individual and family support. It is actually housing and shelter. So we get a lot of requests for housing and shelter and for food assistance. So, this is the kind of data that you will be able to pull for your own programs and for your own organization whenever you're pulling these reports. And these are the top 10 receiving organizations. We have Catholic Charities, City Serve, Dignity Health, Bakersfield Special Needs and Community, Links for Life, Exceptional Family Center, Bakersfield Homeless Center, the Mission at Kern County, Independent Living Center, Turn, the Utility Reform Network, and Clinica Sierra Vista. You also get information on rejected referrals. So some referrals get rejected, they get sent back over to you so you can send to another organization. The number one reason for rejected referrals is client isn't eligible for those resources or services. And then we also have, they do not provide the service requested. So we have to make sure that, we are looking at the organization's profile so we can see whether or not that client is eligible before we send them over. But this is some of the, just a quick overview that you're able to pull from Tableau. Okay, and this is some of the activity that we have with referrals. We started out with about 5 referrals in 2020, and slowly we've been able to pick that up. Here in December of 2020, we had an organization who held a virtual health fair, and that's why you see that 82 referrals jump right there. That health fair collected, client information that was placed into the Unitas platform, and these organizations were then sent out to resources in the community to receive mammograms, get some feedback on physicals. And so that's where you see that spike. From there, we've been able to, continue to work with the activity. Unitas has a team that works on optimization. So they are working to make sure that that activity stays as active as possible. And so we are looking at some referrals, still hoping to, the more organizations that sign up, the more programs that we have, we'll be able to see more activity happen within the next year. And then if you look here, these are accepted referrals. That's the green part here. A lot of them were for food assistance, housing and shelter, and physical health. These are the number of cases that were open. So cases are, they're open to assist the client. And so you get food assistance. If you have, an organization that assists with housing and shelter, you would open a case and you would be able to make notes and updates to that client's profile. As you can see here, 53% of the cases opened were resolved. 31% were not resolved, and 16% are still open cases. So a lot of the reasons that they're not resolved, either the client, is no longer in need of those services, or there is no longer a need for, the program is no longer has funds or the capacity to assist, or they are just not eligible to continue with receiving services from that particular organization. Okay, these are service episodes. So a referral and a case can be considered a service, each is a service episode, right? So if we have a client who comes in and we're having a conversation with this client, we realize that this client needs 2 electronic referrals, one for utility assistance, one for food assistance. That's considered 2 service episodes, right? And then a case is opened because we can serve the client here, and we start to, make notes and start to get some information from the client. That would be a 3rd episode. So anything that you do with a client, whether that be a case being opened or an electronic referral being sent, that would be considered one service episode for each. So, one client can have as many as 3 to 5 service episodes that you're identifying as you're sitting down and having these conversations with them. This is a network needs report. So you're also able to pull reports on the age, gender, race, and ethnicity of your clients. Race and ethnicity, as your client comes in and you're filling out their profile, if you want to receive this data, you would have to ask those questions, right? And update that in their profile. Once that is updated in the profile, this is, you'll be able to pull this report, and you're also able to take a look at the occurring needs for these clients. So here in Kern County, about 55% of the clients served through KCCN were between the ages of 18 and 44, and 57% were males who who were in need of services. This is our network coverage. Currently, we have 98 organizations built out in the system. We have 233 active programs, and we have about over 105,000 users who are active on this network. This is the service type that they are connected to. So you're looking at individual and family support, education, social enrichment, food assistance, and the list goes on. So this is all of the data that you'll have access to. You'll be able to click and hover over where these organizations lie in Kern County. So if you are looking at, Central Bakersfield, Shafter, Wasco, you'll be able to just look at this map and take a look at what organizations are active in those areas. We have local partners who have formed a community bank and assist in the funding of this program. We have Dignity Health, Kaiser, Blue Shields of California, and Kern Health Systems. In order to join the network, nonprofits have no cost, right? They can join the network at no cost, and they have unlimited licenses available to them. Stephanie will speak on that in a later slide, but thanks to these partners, and then Kaiser and Blue Shield of California take care of the entire state of California to make sure that all of this is at no cost to nonprofit organizations. But I'll let Stephanie talk a little bit more about that. And so Stephanie, she is with Unite Us, and she'll continue the slides forward.
Yes, thank you so much, Cristina. And as Cristina shared, my name is Stephanie Martinez. I am a Senior Community Engagement Manager with Unite Us. And I'm going to be talking a little bit about, the network. We've kind of heard like how it works to connect people, but we'll go into a little bit more depth. So in California, you can see the map here on the left slide, or the left part of the slide. You can see counties that we are already live in and counties that we will be launching later this year. And so what this means is that if somebody in Kern County is in need of assistance, but they are moving to Tulare County or Fresno County, or maybe even down south to Los Angeles, case managers can still request services, and they can even request them in the areas that they're moving to, or they're able to see their journey as, they move or maybe come back into Kern County. Furthermore, because of the pandemic, most of us are familiar with having to shift to remote work. Some organizations have continued to be remote and are now operating completely virtually. So at Unite Us, we do have organizations that are completely virtual, and they may be located in San Francisco, but they are able to help any individual throughout the state. And so somebody in Kern County who, let's say, is in need of utility assistance or professional clothing might be connected to an organization that's not in Kern, but that can help them virtually and, are able to give them that clothing or pay that bill that they need help with. So that's the benefit of Unite California and Unite Us connecting residents from Kern County throughout the state. So yeah, we can go ahead and go to the next slide. So Cristina did talk a little bit about community-based organizations and the way licenses work. So when it comes to an organization that is a 501c3, they get completely unlimited licenses for free. So we want to really thank our sponsors for that, which we had on the other slide, you know, with Kaiser being one of them, Blue Shield and Dignity Health, so on and so forth. It's because of their belief in the product that we're able to give these licenses for free. I know a lot of times people think, you know, this is too good to be true. Somebody did pay for it. You all just don't have to. Also, when it comes to safety net clinics or FQHCs, our certified community and behavioral health clinics, they will also get the unlimited license as well. So we know here in Kern County, you know, Clinica Services is a big one. So they have unlimited licenses. When it comes to county departments, city government, public health agencies, county agencies, so on and so forth, you know, school districts, they do receive a limited amount of licenses for free. And if any of you all are, you know, working with those agencies, I'm happy to talk to you, take a separate meeting to go over like what that would look like and to connect you to the appropriate people at Unitas. But of course, there's always room for a couple of licenses for free. So you can maybe pilot a program. And the reason we do this is because we know how important it is for nonprofits to be able to refer their clients to these county agencies or to even school districts, right? We know that a lot of the school districts in Kern County have family resource centers connected to them. So we want this network to be representative of all types of organizations that can help the community. And that's why we have the ability for different organizations to onboard in different ways. When it comes to, you know, our community bank, we do have here that, you know, most healthcare organizations do pay to access the network. And we will really look at to what they're looking for, and the pay will vary. So if they're looking for any kind of integrations beyond their electric health records, you know, there's a separate cost there, depending on how they want to use the data that is collected here. And if they want any specific and tailored customized screenings, which we can add onto the platform, there are additional costs. But for the most part, most of our CBOs, which I work with closely, are nonprofits, you know, they really don't need any of these things. And so it being completely free works for them. So just wanted to kind of show the two different ways that organizations join the network. Now, this is a quote here from Garden Pathways. Here at Unitas in Kern County, we love Garden Pathways. They've been a champion in the community for us, and it's worth reading. So Unitas has been very beneficial for Garden Pathways in our day-to-day operations. We are able to effectively manage our referral system and monitor duplication of services. Unitas effectively provides the platform for cross-collaboration and a continuum of care for our participants. And that's really what this is all about, why we want to be involved and onboard as many organizations as possible. It's for that continuum of care for the participants. So if you all remember the video that we showed earlier, that was one type of visual for how the network works, but we also have this visual here, and especially for any of those who arrived late, this is a good refresher, or this is just a good way to view. So of course, one client may come in and they're working with one organization. In this case, we have the Bakersfield Homeless Shelter. Now, the Bakersfield Homeless Shelter can help with housing, right? Emergency housing, but maybe they find out that this client has other needs they can assist with. So maybe they need diapers for their kids, they need food, and they need some kind of health services. That's where Unitas comes in. They will make that referral, and then the service provisions will be sent out to organizations like CityServe and maybe also Catholic Charities. They'll put them in the system and wait for CityServe and Catholic Charities to update. So that way, that case manager back at the Bakersfield Homeless Shelter will be able to know, okay, my client did get help with the diapers. They did get that food that they needed. And they will be alerted to any updates that happen with that client's case. And so that is how it works when somebody gets a referral made in the Unitas software. On the next slide, you'll be able to kind of see what the software looks like. Unfortunately, we're not going to be doing a demo through this presentation, but if you'd like to see how this platform would work and talk about how we can integrate that into your day-to-day work, I'm more than happy to do that, as is Cristina, but this is just a screenshot of what it looks like. So a single master person index would show you, this client needed emergency food. You can see that it was all resolved. You can also see that they needed housing assistance, as well as their care team on the side. So you get to see all the different workers at all the different organizations that are working with them. We'll also on the next slide show you a little bit closer look at those care teams. So this slide goes pretty fast, but it basically walks you through how you would enter somebody who needs help. So you're going to enter their need, you go to the browse map, you can see with the filter how far away you need these organizations to be from the client. You're going to go ahead and click on those organizations. You're going to send it to more than one. And then you're going to say, yep, I'm ready to send that referral. And now those referrals are going to be added onto the client's case. You're going to write a short description, and then you're going to hit next. Now, this is going to open up to an assessment form. These assessment forms are optional, so you wouldn't always have to do this. And then, you're going to send that referral. So in here, we're referring our client, Eric. It's just starting over so that you can see it again. So it's on a loop. So how you would actually send that referral and how it works. When you log into Unitas, also you're going to get to our dashboard, and this walks you through what it would look like so that you're seeing what's happening at my organization. How can I actually enroll this person into services? And really you can see the interface as well. It's pretty easy and was modeled after like your email inbox. You can also see how you would close a case. So that gives you the correct data so you can see what's happening at your organization, which types of cases are being closed, which type typically don't get closed. Those are all things that can help you when you're reviewing data, maybe for grants and for growth at your organization. So again, this is just on a loop. So it's going to show you what that looks like when you log in. Now, the biggest thing that comes to mind for most people is lots of organizations are working with one client and we can all see what's going on. That has positives, but it can raise privacy concerns. And so we want to let you know that client privacy is our priority. So number one, client data cannot be shared via referrals without client consent. And we do offer client consent in over 50 different languages. We do protect clients' most sensitive information. So substance abuse or other, if there's interpersonal violence, those type of referrals have limited viewing permission. So not everybody that's working with that client will be able to see that that client is being referred for those sensitive types of services. Only the sender and the receiver, not even everyone at those orgs. So just the case managers working with them will be able to see what is happening, and that's really it. So the same way that it would be if somebody hopped on the phone and told, hey, unfortunately, my client maybe has a substance abuse issue, they need help. The case manager at this organization would contact someone at that organization, and those two would know. So it's the same type of way that it works on Unitas. We also keep our client data secure. We are HIPAA compliant. We are also HITRUST certified, which means that we are adhering to all federal standards for privacy and for our secure data. We do have a third party that essentially tries to hack into our system every year as part of our security that we have. And they will let us know if they were successful or not, because they're basically testing how secure our system is. So we take it very seriously. We want to make sure that, our system is protecting clients' privacy.
And I did want to add real quick, even though, like, let's say I send a referral over to Clinica Sierra Vista, and it, once they accept the referral and now, this client becomes their patient, even though I'm the one that sent the referral, I no longer have access to click on that referral. It'll have a lock on the side of that referral where it says, I no longer have permission to look at that client's referral, because now it's been taken over by Clinica Sierra Vista, and it's, patient information. And so that's something that, is, Unitas does a very great job at protecting patient confidentiality and privacy.
So for next steps, if anyone would like to learn more, you can visit california.unitas.com. You can submit a get more information, form. And then for those of you who maybe already know about Unitas and you've been sent a partner registration form, that's what you need to, in order to join the network. We say submit that form, get it in so you can be part of the network. We'd love to have you on. We can, if you're interested, we can definitely work with you, have meetings to figure out how we can integrate into your workday, and how just our system would work overall with, your standards. And then we'd also love to know who would you like to see on the network. Cristina shared we have about 100 organizations on board. We know there are a lot more in Kern County, so we want to hear from the community who should be on the network. And I'll also add my email into the chat if you have any questions, want more information about Unitas, you want to join, please don't hesitate to reach out to me. I am more than happy to have that meeting with you, as well as to actually demo the software so you can actually see how it works and not just have the screenshots, which I just shared now. So yeah, instead of going into the software demo now, please contact me if you'd like to see it and I can walk you through that.
Okay, so we are going to ask a few questions to the group to see, what are your thoughts on the Kern Connected Community Network and Unitas? So if you would like to unmute yourself or just place it in the chat, let us know, what are your thoughts so far? From what you've seen, is this something that, could be useful for your organization?
Is there anybody who is an attending who's actually using Unitas at the moment to provide referrals to their community? So I do have a question for you ladies. So as you have dealt with some of the hesitation, can you share a little bit what of the hesitation of some organizations as they've said, I want to join, but I don't want this to be a huge add-on to my current workload of what I do as a coordinator or as a service technician. Can you share a little bit of how you walk through that with them and get them acclimated to the system?
Yeah, I can jump in here. So it's our priority that using Unitas and the software does not make your workday longer or, more difficult. We really pride ourselves in making your workflow more efficient. So we'll start by asking questions like, how is it that you're currently receiving referrals? How is it that you're tracking them? It's really important to a lot of organizations based on their grants, right, that they can show outcomes. And so we take all that into consideration, and then we will walk you through how to use a platform to best work with your organization. If you should sign up as multiple organizations or just one, if you want to start out sending referrals, or you want to start out receiving referrals, or you want to do both, we'll work with you to make sure that you have the best experience with it. I think, of course, there is that hesitation, right? How can we add on something new? This has been really difficult through the pandemic. We had to learn so many new things, and we just don't have the capacity to learn another new thing. And, with that, I just simply share, the digital transformation is going to happen anyway, right? There's a study that showed that on average, nonprofits are behind the private sector by about 20 years in how they're utilizing technology and how they're getting their, data. And it's really unfortunate because there are so many tools for free that can help. And, we talked a little bit about how nonprofits now, there's you know, a lot of policies happening in the United States to where nonprofits can actually get paid for the work that they're doing. And we want to make sure that nobody is left behind. Everybody has the ability to get in on all the changes that are happening with the digital transformation, with policy changes. And so I'm very passionate about that, working with nonprofits specifically, because I want to help those that are helping the community. And so I think we just start by listening to you all and hearing how we can best integrate with you, and then holding your hand. Once you sign up, you know, we don't just leave you. Cristina is there locally to help with any kind of in-person training that you may need. I'm here to help you via Zoom. And I can also go pay a visit, you know. There's self-paced training videos that you can watch. You can come in to lunch and learns. Like, we have so many options to help you with trainings. And I have nonprofits all the time that just send me an email like, Stephanie, I don't know how to do this. I'm like, great, when can I call you so I can show you? You know, so that's kind of my thoughts on that question. That was a very good question.
Yeah. I would say that some of the concerns that I've heard from folks is, one, you know, we already have a system. We have multiple systems that we have to use, and this is just another one that we're adding. And so one of the things, you know, that, you know, the way that we kind of walk through it is, you know, if you have a system that you're happy with, we're not here to replace your entire system. We are here to provide a tool where you can, you know, utilize the Unitas platform to send your referrals to other outside organizations and collect the data from all of that, and just be able to keep the information from your system up to date with your client information and whether or not referrals were accepted or rejected. So that's one of the ways that we kind of walk through that, is, you know, showing them that to use Unitas and KCCN as a tool to better assist the clients that they have, and not here to completely replace the systems and programs that you're currently using. Because maybe it makes sense in your organization to have that system. You know, it has more information, it has more detail, you're better able to communicate internally, but Unitas is able to help you communicate with other organizations externally. And then also another concern that we hear is security. Folks are very wary about putting client information into a web-based program. And so, you know, as Stephanie mentioned, Unitas is HIPAA for FIPS compliant. They have people that, you know, that they work with to make sure that their system is secure. And so, you know, we do have a security overview sheet that we can also share that talks a little bit about that as well. You know, if anyone, these are still discussion questions. So if, you know, how can the data collected assist your organization? Is this the data portion, was that something that you think is helpful for organizations or programs to have? And how would you use it? So I'm gonna see if there's any questions on the chat.
There is, we have one from Norma Bautista, and is 211 included in this network?
So 211 is not yet a part of one of the active platforms. I know, Stephanie, you might have more information on like the 211 programs throughout the Central Valley and how they have agreed to be part of the Unitas platform.
Yeah, so overall, Unitas has a goal to work with every 211 in every community, because we really value the work that they're doing. And we have great relationships with 211, like especially in Los Angeles, right? They are one of our champions. And so conversations with 211s happen on a, you know, a county basis. And so in Kern County, of course, we would love to have them join as our partner. And those are conversations that we're having.
So I'll share a little bit of our position or place in this at First 5 Kern, why we have embraced the network as well as Unite Us. And if we all take a step back, as we learn more about ACEs and how our reach and our clients interact with us as organizations, we recognize that part of the delivery of our service is that we have to build relationships and confidence. And a lot of the times in my previous life as a coordinator of services for the housing authority locally, my job was to help them get to the service. But unless I was able to reach out to the family on a consistently basis, and check in with them, were you able to receive the service? How did that happen? There was a lot of, on top of everything else that I had to do, that maybe was a little bit more difficult to find out if those services were reached. The last thing we want for a family to feel is that we're sending them to another organization for a service or some type of referral, and they're intimidated or they are not able to get there. Through Unite Us, we're able to make sure that the clients are being connected, almost like a warm handoff, to make sure that those resources are being served. And if there are any issues or any concerns, there is that opportunity to know immediately and be able to contact your client at that time. So we are at 12:04, and are there any other questions or anything that the group would like to share as far as what is being done in your organization or in your area of work? Well, I thank you. Is there anything else, ladies, Cristina and Stephanie, that you would like to share with the group?
This is our contact information. So if you guys would like to know more about KCCN or would like to, get a demo or have any questions, please feel free to reach out. We are more than happy to schedule something, to just have a conversation over the phone, to meet up and see if this is something that, could be helpful for your organization or program. We can also send you information for your leadership team, so they can kind of review and take a look at it and see if this is something that would make sense. And so just remember that, once you become an active partner, you will be part of a community advisory group. So you will be able to kind of work alongside other active partners and see how we can improve the Unite Us platform and KCCN. And so just make sure that, if you have any questions, we're here to answer those.
Stephanie, any closing remarks that you would like to share with the group?
If you are interested or even have an inkling of interest, please contact us. As Cristina said, we would love to just hear about your organization. The network is only as strong as those organizations on it. So the more that we have on, the better the data is, and the better able we are to help the community members get the services they need.
Thank you, everyone. I want to take this opportunity to thank you all, particularly Cristina and Stephanie, for leading this conversation. And thank you for all the work that you continue to do throughout the community. And for you for joining us. This recording, along with other recordings of today's conference, are available in Whova and will be for the next 3 months. The PowerPoint presentation that the ladies shared with us today is also available in Whova in the document section or resources section. So if you have any questions, please feel free to reach out to us. We invite you, actually in the next hour, we have the exhibitors Q&A live session, and that'll be throughout the lunch hour. And you're welcome to go in and interact with several agencies freely and ask any questions that you would like to ask. I will go ahead and place the link of the actual session for you if you would like to connect. Again, thank you so much and have a wonderful rest of the conference.
Great, thank you.